Next, we're going to look at the olfactory nerve. So I'll start by showing you what the image is. I've started to draw. So this is the frontal sinus, and this is sphenoid sinus. And then we have the nasal cartilage here, and that's a nasal septum. And then what we're going to do is draw the olfactory nerve, so cranial nerve 1. So that's the olfactory bulb. There's actually one on each side, but I'm just drawing one side for ease. And then these represent the nerves passing from the sensory cells here and the axons of the cranial nerve. And they pass from the nasal cavity through the cribriform plate, which is represented here, into the anterior cranial fossa. And then they go into the olfactory bulb, and that's lying in the olfactory groove. And then here they synapse with mitral cells and second order nerves, and then they pass back as the olfactory tract, which is here, and that goes to your brain. The tract then divides into two, so you have your lateral tract and your medial tract. The lateral olfactory stria carries signals to the primary olfactory cortex in the temporal lobe, and then signals are sent to the piriform cortex, the amygdala, and the entorhinal cortex, and they're involved in memory of smells. So that's your memory of smell. And the medial olfactory stria transmits signals to the hypothalamus and the brainstem. So if you lose your tracts and there's destruction, you get anosmia, which is loss of smell. And then the blood supply is from the olfactory artery, so quite easy to remember. And that's a branch of the anterior cerebral artery. It's also supplied by anterior and posterior ethmoidal arteries, which are branches from the ophthalmic artery. And then venous drainage is poorly understood and not well explained, so I can't really tell you where the venous drainage is.